Good afternoon, everyone. Here we are on a Wednesday afternoon. I've got a couple of things to chat with you about today. The first thing I'm going to say, though, is about the situation that's unfolding in Washington, D.C., that has been unfolding for the last couple of hours, where the U.S. Capitol is under assault and under siege by protesters, thousands of protesters, hundreds of which have entered the Capitol. Elected leaders are on lockdown, trying to be removed from the Capitol. It is a very, very dangerous situation, and I think it goes to the point that words matter, rhetoric matters, civility matters. We have escalated to a situation where now we have the world watching and the world tuned in to this situation that has been unfolding for about the last 2 hours in our nation's capital, at the Capitol building. So I hope that Capitol Police, DC Police are able to contain the situation peacefully without anyone getting hurt, and so that we can have the peaceful transfer of power that is absolutely fundamental to our democracy. So a very concerning situation, like something we've never seen before in this country. We sometimes watch it on the news in other countries, but never seen anything like this in this country. So that's just a very concerning situation. Okay, if that weren't enough, on to talking a bit about COVID. And I'll talk with you about the numbers, and then, of course, I will take your questions on COVID and on anything else that's on your mind. So, yesterday we reported 108 new COVID cases in the city of St. Louis. That still brings our, sorry, let me get my papers straight here. All right, we're at about 34, 35 cases per 100,000. And I'm sorry, I can't, here we go, I'll lay my hands on it right now. 31.8 cases per 100,000 in the city of St. Louis as of through the cases reported yesterday. We continue to be considerably less than the state as a whole, which is at 52, and many of our surrounding counties, which are some are nearing 70, some are in the 50s. So again, that is hats off to the residents of St. Louis and to our businesses, many of whom are doing a great job of following all the mitigation strategies of mask wearing, social distancing, hand washing, and keeping their places of business safe. So those are the case numbers. Now, in terms of hospitalizations, those of you who watch all the time know that these numbers lag 2 days behind. So the number of people currently in the hospital with either confirmed or suspected COVID is 923. The number of people in ICU is 171 of that 923, and then 109 of those folks are on ventilators, so very seriously ill. Number of people discharged from the hospital yesterday was 109, so the hospitalization numbers are coming down a bit, just like the case numbers are coming down a bit. Still quite high, but and not heading down as quickly as we would like, but nevertheless heading down a bit in the right direction. Combination of following the mitigation strategies, and I think right now our challenge is to persuade people to continue to follow those mitigation strategies, particularly when we know that the vaccines are on the horizon. And we know we have 36 nursing homes, for example, in the city of St. Louis, and we know that they for the most part, do have contracts with CVS and Walgreens. We've spoken with all of them in the last few days, and they are waiting on vaccines to come their way in order to be able to vaccinate their staff and their residents. We are also, Dr. Eccles talked this morning with the state, and we are expecting to get some doses. We didn't know how many soon for our first responders, healthcare workers, folks that are not affiliated with hospitals. So that would be federally qualified health centers, also paramedics, EMTs, EMS, folks that are very, very on the front lines with potential COVID patients. That includes our firefighters and our police officers as well. So we are, like everyone else, we are waiting to get the distribution. We are expecting it to improve, to the distribution to improve. However, of course, it's never as fast as we all want it to be. So we'll talk more about that later. But with the announcements of the vaccine about a month ago now, close to a month ago, I think we continue to be challenged in terms of having people continuing to wear their masks, continuing to social distance, because everybody's trying to get over that finish line, and that is still a ways off. You probably saw on the news yesterday the St. Patrick's Day parade in Dogtown has been canceled. I think most of you know the Mardi Gras parade and in-person festivities are canceled. There will be some virtual festivities. And so those big events that come in the early spring usually are continuing to be put on hold until we can get a better handle on this virus. We're all concerned about the variant of the virus, and I know Dr. Eccles is watching that continually. At this point in time, we don't have cases here, but it's probably only a matter of time. So I will stop there on the numbers, and of course take your questions, and hopefully be able to provide you with some good information.
Bill's question, Mayor, has to do with nursing homes and tracking COVID in nursing and congregate care facilities in the city of St. Louis. How is that going in the city so far? And when are they getting their vaccines?
So, Bill, we just talked about that a little bit, but there are 36 nursing homes, congregate care facilities in the city of St. Louis. They all expect to get vaccine within the next week or two, and that's variable. But when they do, they have contracts with CVS and Walgreens. You've seen some of that on the news. In order to get both their employees and their residents vaccinated. Likely to be the Pfizer vaccination, which, as you know, is a very cold storage requirement. But we do have one of the federally qualified health centers, of course, that we have does have a freezer, a very cold freezer that can handle that.
On COVID, Alice's question is, for someone who is positive, how long is it your understanding that they are actually contagious and able to spread it to another individual?
That question would be better answered by Dr. Eccles, but it's my understanding that his recommendation is that individuals who have tested positive would be quarantined for 14 days. I know there's some folks who at least 14 days. And in some situations, particularly congregate living situations, we often recommend that person be retested if they're living in a group situation, just to make sure that they don't continue to be positive. So I'm not sure exactly what the source of your question is, but it varies a little bit.
Chris's question has to do with long-term symptoms of COVID. Is that something the task force or the health department are tracking or keeping tabs on, how long folks have symptoms of COVID?
So that is being tracked, as I understand. Tracked is maybe not the right word, but followed by hospitals, by primary care physicians, because of course we've had COVID in the region now for about 10 months, 11 months, I guess it is. And so there is, that's long term, but not extremely long-term. So I know that we have had some conversations at the Pandemic Task Force about some of the symptoms that some physicians and some hospitals are seeing in people who had COVID, and whether they're continuous symptoms or whether they are symptoms that crop up later, and are they causative or are they correlated? So that certainly is being very seriously looked at by the medical community. I know Washington University, for example, has some studies, ongoing studies, about the long-term effects of COVID.
We have another question from a Chris, don't know if it's the same Chris, but in the city or in the state of Missouri, do you know if justice involved or incarcerated individuals are included in the vaccine schedule?
They are. The vaccine schedule is comes down from the CDC. And so there's phase 1, and phase 1 is frontline healthcare workers, first responders, good, somebody's got it written down for me, nursing homes. Phase 2 is incarcerated individuals. It's also people over 65, folks with underlying medical conditions. So incarcerated individuals fall into the phase 2 of vaccine distribution.
A similar question from Kristen, who's watching. Do we know about salon, spa employees service in those service-related industries? Is there going to be a registration for them to get vaccinated? The Missouri's website doesn't include it yet.
I don't know the answer to that. I think when you think about any worker that is in close contact with the public, is on the schedule to be vaccinated, but ahead of them right now are frontline healthcare workers, first responders who were responding to emergencies, individuals that are over 65, individuals who have underlying health conditions. So, and there's some talk about grocery store workers, some of the employees who work in industries that have to continue to work. So I don't believe there's any special listing for salon workers, massage therapists, tattoo artists. All of those folks fall into a category of personal services, but they are not. They're not prioritized at this point.
We just posted the phases, by the way.
Okay, thanks.
And Chad has a question. I think he's a business owner about the 11 p.m. bar closing in the city of St. Louis. Do you have an update on that? How much longer with the vaccines beginning?
Chad, we don't know how much longer. At this point, I don't see lifting it. As you know, the county just 2 days ago even allowed indoor dining or indoor beverages to be served, and their closing time is 10 o'clock. So we feel that this moderate, middle-of-the-road approach that we've taken to try to keep people employed in the restaurant and bar industry, as well as to try to keep people safe, has struck a pretty good balance. And at this point, with the numbers as high as they are, which even though they're going down a tad, they're still extremely high, and this virus is still extremely contagious and spreading in our community. So there is not a date for those for that to be lifted at this point in time.
You might have addressed this, but this vaccines to the city of St. Louis, do we know when we can expect ours and what our allotment will go toward?
Well, see, it's not exactly, quote, ours. So we are expecting some vaccine to come in the next week to 2 weeks. That would be for federally qualified health centers. We don't know how much yet. But in addition to that, the state is supplying vaccine directly to hospitals. They're supplying vaccine directly to CVS and Walgreens. And so it isn't that it is all coming from the state to the city and the city distributing out. There are many channels for this distribution. We are anxious to get a good-sized distribution so that we can be sure to be able to vaccinate our first responders. But you may have seen that yesterday the county announced that they got 900 and some vaccinations. So that's not very much, of course, less than 1,000 units. We're expecting to get some in the next week or two in the city of St. Louis, go to federally qualified health centers, frontline workers.
Other questions and topics we got. Stacy's watching and asks about freeholders, Mayor. Did you get enough applicants, and are we still committed to moving forward with that process?
We do have lots of applicants. As some of you may know, Stacy, I submitted, I think, 3 different sets of applicants to the Board of Aldermen. They chose not to act on any of them. And so, I have been in conversations recently with President Reed about the Board of Freeholders. It's very important. There's no need for me to send over additional names if we can't get some action from the Board of Aldermen. We're still hoping to do that yet this session. Now, I think for those of you that applied, and there were, I'm trying to remember, over 100 people who applied in the city of St. Louis. Many of the people who applied, by the way, were it wasn't from a diverse area across our city. Many people from the Central Corridor, some people from South St. Louis, a few people from North St. Louis. So it's important that this Board of Freeholders have a good geographic as well as racial, age, and political. It's required by law to have political party diversity. So those things are important, but I think what's the question now, the county has had some of their freeholders pull out, so they don't have a full set of freeholders at this point. And there's some question about whether or not those signatures, which were collected almost 2 years ago now, as to whether or not that's still valid. The law on this is very vague. The state law is very vague. So I still would like to get the Board of Aldermen to act on a slate of freeholders.
Another vaccine question from Rhonda, who's watching, Mayor, and is a healthcare worker, but independent from a major system. How can people in the area find out when it's their turn, or we've reached a phase where they're eligible to get it?
Rhonda, right now, we're still on phase 1A, which is frontline healthcare workers. And maybe you work in a doctor's office or an urgent care office or a dentist office. I mean, there are a number of different medical offices, of course, but we are not to that point yet because we haven't even vaccinated all of the hospital workers and frontline hospital workers. So as soon as we do go to another phase, it will be well publicized.
That is it for questions today, Mayor.
That's it. I know that we all want this vaccine and we want it as quickly as possible. The production of the vaccine, the distribution of the vaccine has all been a difficult situation. And so we're hopeful that the federal government will make some strides, some good strides on the distribution of the vaccine that is available from Pfizer and from Moderna. And maybe coming from AstraZeneca or from Johnson & Johnson. Some people are looking forward to the Johnson & Johnson vaccine. It's not been approved yet because it's 1 shot, not 2. So anyway, we all want that vaccine as soon as possible, and we want to persuade as many people as possible to get the vaccine. I know the hospital systems that are in place on the pandemic task force, they're reporting that about 60% of their employees have agreed to take the vaccine so far. So thank you all for being with us this afternoon, and be safe, and appreciate all of you. Thanks for wearing your masks and making St. Louis's numbers the best possible. Thank you.